too much time now, so I will go ahead and introduce Dr. Rivkees, who's here with us. He's Florida's Surgeon General, is focused on protecting, promoting, and improving the health of everyone who calls Florida a home. As Surgeon General, Dr. Rivkees has also serves as a state health officer for the Florida Department of Health. In this capacity, he oversees the operations of the state health office in Tallahassee, 67 county health departments, 22 area offices for the Division of Children's Medical Services, 12 regional offices for the Division of Medical Quality Assurance, 9 area offices for the Division of Disability Determinations and other 3 public health laboratories. He has also committed his career to building a culture of health that can help each adult and child in Florida live a long and healthy life. And I feel like in a partridge in a pear tree would be the COVID for the year that has probably thrown quite a wrench into your service here for us in the state of Florida. So I would like to turn the podium over to you, and excited to learn and hear what you guys have to say tonight.
Great. Yeah. Thanks so much. Yeah. First, congratulations on your election. We've met each other before. I know you're going to do a terrific job, and happy to work with your association in any way. Also, it's a pleasure to be on the same speaking program with Dr. Karen. Both of us were both pediatricians. I'm a pediatric endocrinologist. Before I started this position, I was chair of peds at University of Florida for almost 8 years, and before transitioning to this role. So, my God, what a year this has been. March 1st was when we had our first 2 cases of COVID-19 diagnosed in the state of Florida. And here we are, December 10th. We've had more than 1 million Floridians diagnosed with COVID-19. We've had about 55,000 people hospitalized, and sadly, we've lost 18,000 fellow Floridians. And always, those of us in healthcare, our heart goes out to the families, friends who have been affected by this really harsh virus. In terms of where we are with trends, it's interesting. Our Department of Health website, we publish our data every day. The positivity rate really for the past month has gone between 6 and 9%. A couple other things that we look at in terms of the RT value, which is an index of spread. If it's 1.0, it means 1,000 people give it to 1,000 people. If it's above 1, we have an increased spread. And right now, it's about 1.1. Another thing that we look at are the number of new cases per 100,000 per day. And right now, we're at about 44 new cases per 100,000 per day. At our peak back in July, that was about 55 new cases per 100,000 per day. And at that time, we had about 12,000 people in the hospital. At the present time today, we have about 4,000 individuals in the hospital with COVID. That number is going up at a relatively low rate, and I should say that throughout the state, we're in touch with the hospitals regularly. All the hospitals are being able to deal with the increased number of cases. In terms of where we are compared to the rest of the country, as we're all hearing, this current wave that we're in is really throughout the country. However, we're doing better than many states in terms of looking at the number of new cases per 100,000 per day. Florida is actually 44th compared to other states. In terms of what we continue to learn about this virus, learn a lot more about the basic science, the basic biology behind this, but some things reign true, and that is, in terms of transmission, we're dealing with a respiratory transmitted virus, and also a virus that can also have aerosol spread. We have been, talking about the importance of wearing masks. One of the things that we did very early on in Florida was recognize the value of this. And actually, I think we were probably the first state, if not one of the first states, that actually had workers working with individuals in nursing homes, assisted living facilities, wearing masks, adopting mitigation measures. So we still advocate for masks, the hand washing, the physical distancing as well. Also, in terms of trends within the state, we now have about 1.8 million children who are back in education, K through 12, and this has gone very, very well. Very, very few school closures in terms of schools impacting community spread, something we've been looking at. We have not seen a link there. And this is something that we're working really to continue to support the schools. Same with the universities. Under the state university system, there are more than 500,000 students who are actually back in education. And they've done a terrific job. And in fact, the positivity rates of students in the universities is substantially less than what we have seen in the community. A few things have come out recently in terms of changes about CDC guidelines related to quarantine and isolation, which are important for us to go over. So in terms of what constitutes a significant exposure, and I'm sure you're all aware of this, if we talk about the CDC standard is within 6 feet of 15-minute exposure in the community, irrespective of whether people are wearing masks. Healthcare setting is different. So it used to be, they would say those individuals would need to isolate for 14 days and monitor their symptoms. A week ago, the CDC actually changed this so that you can now have 7 days or 10 days. And you can, if without testing, you can typically come out of isolation at 10 days, assuming you don't develop symptoms. And then come out of isolation at 7 days if you're tested at days either 5 and 6 and they're negative and you don't have symptoms until day 7. So this has big implications for the school population, the workforce. However, and this is important to emphasize, for individuals who are working with high-risk individuals, such as individuals in nursing homes, assisted living facilities, we recommend the standard 14-day isolation. And this is, again, based upon CDC. But this is a way to actually have some individuals come out of isolation sooner rather than later. And in terms of individuals who've had COVID-19, the current guidelines are that if somebody is asymptomatic, they have to wait 10 days from the time they tested positive before they can go out in public. And if they've been symptomatic, 10 days from the onset of symptoms, assuming they're afebrile for 24 hours and a resolution of symptoms. However, if people have been in ICUs, on ventilators, immunocompromised, then it's recommended that individuals wait 20 days. In terms of this notion of being asymptomatic and a spreader, this is something that really is gaining increasing attention. Individuals who are younger, particularly those individuals in their 20s, for example, about 50% of individuals can have COVID, spread the virus, and be asymptomatic. And this is where the current thought is in terms of where a lot of spread may be coming from the community and household contacts, small group contacts for individuals who have COVID-19 and are unaware and can spread it to others. Also, over the 48 to 72 hours before somebody becomes symptomatic, individuals can spread. So this gets in the importance of wearing masks as an absolutely important mitigation measure. In terms of new therapeutics, so over I guess it's about 3 or 4 weeks ago, the Eli Lilly monoclonal antibody had EUA approval, and then about 2 weeks later, the Regeneron product. And it's important to recognize that these are therapeutics that potentially can decrease the risk of hospitalization for individuals who are in the at-risk category. So primary data have been published. This is the BLAZE-1 study published in the New England Journal early November, where this is what the Eli Lilly bamlanivimab, where individuals who received this who received a placebo in the study had a 10% risk of being hospitalized or have an ER visit versus 3% of the group that had received this monoclonal. So we've distributed this to more than 100 hospitals within the state. And if you have patients who would be at risk, this is something for you to consider. In terms of the at-risk category, individuals older than 65, individuals with diabetes mellitus, individuals with obesity, they're the top group, and then there are other underlying medical conditions. And optimally, this is given within 72 hours, even though the EUA says up to 10 days. This has caused hospitals to have to do things differently. This is given by an intravenous infusion for 60 minutes, followed by 60 minutes of observation. And as we know, many of our infusion centers is where biologics are given, chemotherapy is given, and it's not an area where individuals with COVID-19, or if they get into these areas, to be exposed to individuals who may have underlying conditions. So what hospitals have done, some have set up bays in their emergency room, some have developed different infusion centers, others are working with home health care agencies, trying to have individuals in nursing homes at home have this. So HHS has a website which actually has for the different states, and I think it just got launched today, of the hospitals which have this. And so this is something that we've been working with the Florida Hospital Association to make sure that the community is aware of this new important therapeutic. And then in terms of vaccine, and I believe that Dr. Karen probably may speak about this also. So, so two vaccines that are going to be available in Florida really within the next few weeks. First, the Pfizer vaccine and the Moderna vaccine. These are both mRNA-based vaccines. The Johnson & Johnson Jensen vaccine is probably going to be the next to file for EAU's approval. This has a different technology. This has an adenovirus backbone, whereas the Pfizer and Moderna require 2 doses. It's likely the Jensen vaccine will just require a single dose. In terms of timeline for things, this ends up becoming very important. So earlier today, the FDA met to review the Pfizer EAU authorization. I have not seen the news today, but I anticipate that unless problems came to light, that there will be emergency use authorization. And then I believe on Saturday, the Advisory Committee for Immunization Practices, or ACIP, will meet and talk about prioritization and also developing fact sheets. The same process is going to happen next week for the Moderna vaccine. So in terms of what's going to happen next week, what we anticipate is that we will have vaccine in the state. And based upon the ACIP meeting a week ago, 2 groups of individuals were prioritized: individuals in long-term care facilities and nursing homes, and individuals who are healthcare workers. And within healthcare workers, identifying those individuals who are at highest risk of exposure initially as the initial group to be vaccinated. And so these are what our plans are in Florida. So in Florida, we have 150,000 residents in nursing homes and long-term care facilities. We have 170,000 workers there. When we look at the individuals who have passed away in the state of Florida, 40% of these individuals are in nursing homes in long-term care facilities. 85% of the deaths are people 65 years of age and older. 70% of the hospitalizations are people 55 years of age and older. So, it makes good sense to focus on the individuals most at risk of catching this virus and succumbing to it, the nursing homes and long-term care facilities. And then within the healthcare setting, my gosh, you guys are on the front line, all the time. Since this pandemic has begun, there are more than 1,000 healthcare workers across the United States who have succumbed to this virus, and many more who have been affected by it. So So vaccine, we're not going to get it all at once. It's going to come out in different graduated amounts, but it's going to come relatively quickly. So next week, the state of Florida, we hope to begin vaccinating individuals in some long-term care facilities and nursing homes. The governor announced this in a press conference early this evening. We'll start off with in a few counties. And then in terms of hospitals, because of the cold chain storage with the Pfizer vaccine, we were asked to identify hospitals in the state that had ultra cold storage, meaning they had -80s and can do vaccination. And that number was about 54. Then we were asked to identify 5 hospitals within that where we can send the vaccine as a pilot just to make sure it gets there and you can get it out. And these hospitals have been in the news. These are Jackson in Miami, Memorial in Broward, Advent in Orlando, UF Shands in Jacksonville, and Tampa General Hospital. And so next week, these 5 hospitals will end up getting vaccine. They're already planning to vaccinate their workers at highest risk of exposure, and then also some of their surrounding hospitals. And those highest risks of exposure, people are working in ICUs, COVID care units, emergency rooms involved in testing, and then also whatever else the hospital wishes to designate based upon their exposure. And then the week after that, we anticipate, we don't know how much, that we will have, and assuming this is dependent upon EUA approval, we anticipate that we will have the Moderna vaccine. One of the differences between Pfizer and Moderna can be stored -20 refrigerators versus Pfizer at the -80s, and then this will allow us to push it out. So this is going to happen quickly over the next couple of weeks. One of the questions that comes up is, my gosh, you know, I don't work in a hospital. I don't have a hospital affiliation. I work in an urgent care center. I'm a high-risk exposure healthcare worker. Where do I get vaccinated? So we have had conversations with with the hospitals throughout the state, and these hospitals will be able to serve the healthcare workers in their community, and we will have more detail about that. So, we're excited that really within the next 2 weeks, we will have individuals in nursing homes and hospitals begin to get vaccinated as well. In terms of next prioritization group, again, we're going to look to ACIP for guidelines, but again, this is a situation where the data drives the narrative. One of the goals is really to keep individuals from getting hospitalized, keeping individuals from succumbing to this virus. So this is going to be the individuals at highest risk, those individuals older than 65, and those individuals with underlying medical conditions. And this is a big group of individuals. Florida has more than 4 million individuals older than 65. Florida has more than 4 million individuals with an underlying medical condition that places them at risk for complications from COVID. So we're already beginning to have conversations with hospitals, how we can begin to roster and identify our patients, how are we going to be able to administer vaccine to these individuals within the community as well. As far as side effects, I did not see the testimony today. More information will come out about this, but based upon what was presented at ACIP last week, it's interesting that it looks like that after the second dose, there may be more side effects than after the first dose: fever, myalgias, and more so in younger individuals than older individuals. And so a week ago, CDC was talking about, in a workforce, you may not want to vaccinate everybody on the same unit all at the same time, but rather stagger it because of this possibility. And I'm sure that they will have additional guidance for that as well. As far as contraindications, and again, we'll look what's in the EUA. and what ACIP comes out with for additional guidance. Based upon the, 75% of the workforce are women, healthcare workforce are women. And at the present time, I think that they're going to weigh against vaccinating women during pregnancy and recommend against women who are breastfeeding. But we'll see what comes out in terms of additional guidance. So lots of stuff going on. In terms of the state response, I really feel privileged to be part of this, and I wish everybody could see what I do. In terms of how we manage the state response, we work out of the room, the Emergency Operations Center, where we manage hurricanes and other disasters. So we have Agency for Healthcare Administration, DCF, Department of Health, Division of Emergency Management Services. We are all under the same umbrella. And so we can exchange information and do planning very rapidly. One of the other advantages the state of Florida has compared to other states is that we have a fully integrated Department of Health system, meaning all 67 county health departments, they report up to myself. And this way we can push out common messaging, common approaches as well. And so our health departments will also be involved in vaccination programs. We hope to involve different community partners, federally qualified health centers as well. So a lot's going to happen. A lot's going to happen very rapidly. And so this is something that is really going to be very impactful in the state. I think one of our challenges, the issue in terms of vaccine hesitancy. This is one thing until we start offering it to facilities to really get an idea in terms of the individuals who roll up their sleeves. But the more who do, the better off we will be. So let me pause at this point. I covered a lot of information. I appreciate your attention. And I don't know if we have time for questions now, Adam. I'm more than happy to.
Sure. I was writing in the chat box there a couple of things to use the chat box for Q&A. And one thing I was going to comment is we do have the monoclonal antibodies here available in our community at the hospital system that I work at with outpatient infusion centers already available. So both of those are available here locally. We've been quite lucky in this past little surge here. At least our hospital system, I get daily updates, and we've seen kind of what you described, which was we saw that peak in July with almost 100 patients in our system at a time. But currently across our 1,000-bed system, we only have about 35 to 50 patients on a daily basis currently in the hospital. So although our positivity rate here in the county is around 8.8 or 8.9% at our system, we have a very low hospitalized patient group. Is there any questions for Dr. Rivkees?